Hi, it is a pleasure to be here and to be the winner of the 2021 Connecting Healthcare Awards Service Delivery category. Conectados, which means connected, is a patient support program intended for patients with chronic lymphocytic leukemia and Waldenström macroglobulinemia. Conectados is a Janssen's initiative delivered by the Spanish Association of Patients Affected by Lymphoma, Myeloma and Leukemia, IAL, and it is endorsed by the Spanish Society of Hematology, Chemotherapy, and the Spanish group of CLL. Conectados is an example of how we can use telemedicine to support patients, something especially relevant in these times we are living due to the pandemic caused by COVID-19. Through telephone consultations, a team of psycho-oncologists provide patients with the emotional and psychological support they need. They also give patients information about the disease, lifestyle advice on nutrition and exercise, and they also give patients tools to improve communication skills with the doctors, the healthcare professionals, and also their family and friends.
I'm one of the psycho-oncologists that talk to the patients in Conectados program, as Sergio presented before. The way that we help the patients to improve their day-to-day life, it's in the emotional and communication and therapeutic adherence to the treatment. And we help them to develop some skills that are important to their treatments and their quality of lives, and to support them in their emotional state. That is something really important in the last few months with this pandemic thing. To have a voice to talk with them and that care for them every day or every week or every month.
I think that Conectados has the improvement implicit in its definition, connected. It implies a connection between patients and their caregivers, and especially with some of the most difficult ones to be found, professionals that could help in the emotional management of the disease. We have to remember that patients with chronic lymphocytic leukemia or Waldenström's macroglobulinemia usually intensively suffer the disease as a big emotional problem, thinking about some disease characteristics. My disease has no cure, the disease is so rare, why me? I will have to go to the hospital continuously, or my therapy is forever and maybe more and more aggressive. The help of a psycho-oncologist will be great to favorably resolve all these thoughts, and this will positively impact on disease management and control. It is obvious that this will globally improve patients' life.
For me, it's I think that the best way to help the patients is from a holistic team formed by different partners and different professionals specialized in different areas, and to try to give the patients a complementary but also multidisciplinary help. And for me, from the psychological area, it's really important that this area is integrated in their treatment.
Well, the experience of working in a project co-created and coordinated together with IAL is just excellent. The key to its success is the trust we have on each other. Our partners at the Patient Association are the ones who know the most about the patients and about what they need. At Janssen, we have the knowledge and the experience setting up all the projects. So we work hand in hand, and we monitor closely and regularly the evolution of the project with the aim of getting better. We listen to the patients that are in Conectados, and we make changes as we go along based on their feedback. And we also work with hematologists who help us implementing new changes to improve the program. The coordination and cooperation between all the different partners is key. There has always been a continuous exercise of transparency and trust between partners, and we have always been open and transparent in all our meetings and communications. But in this case, the role of the compliance and the legal departments of the different organizations has been essential. So if someone wants to set up a project like this, it is key that you speak to your colleagues at the legal and compliance departments for advice. At Janssen, we follow all the transparency regulations, and they are shown on the website.
I would say, please do it. If you have an idea that you think it could help to our patients, you have just to start. You should know that patients groups, IL for instance, or pharmaceutical companies such as Janssen, or scientific societies as the Spanish Society of Hematology and Hemotherapy, and many professionals are willing to help you in the development of your idea. Our patients need any help, even that one that could seem very simple or too easy. Remember that most satisfactory projects usually start with a single idea.
So the first thing I'll tell someone that wants to create a program like Conectados, or in this line, is to listen to the patients and to listen to the people, to the target people. I mean, when you listen the people that you are going to provide the service to, you can take into account their opinion, their needs, their uncovered needs, and you can try to help them in a full way.
I would tell them to just do it. Go for it. But the most important piece of advice I could give to someone who wants to set up a patient support project is to ask the patients what they need, how you can help them, and then work hand in hand with the patients. I believe this is the best way. Co-creation is the backbone of a successful project for patients.